Leaders from I Am Pobulayo Fighting COVID-19 Trust, a multi-stakeholder coalition made up of medical practitioners, the business society, the donor community, the Bulayo community at large, the diaspora community, the church leaders, are joining us this afternoon in a conversation on fundraising to achieve the works that lie ahead. Good afternoon. I'm Batabile Dlamini, your host, and I hope you are having a pleasant afternoon. So do be advised that this is a live stream on site and on I Am Pobulayo Fighting COVID-19 Facebook pages. And to follow those platforms, visit www.facebook.com/site or www.facebook.com I am for the figure BYO. So on this platform, this is where you're going to share your contributions, and I'm going to forward them to your guests so that they respond to them as the discussion develops. Don't wait for the last minute to share your burning questions. And most importantly, share the link so that this information reaches all the different platforms. So before I introduce our guests, I would like to let you know that these are leaders from I Am Pobulayo Fighting COVID-19 Trust. And they're here really to talk to us, to have a genuine conversation on fundraising. So in no particular order, we have Mr. Walter Chikwada, who is the MD at Zimplow, CZI National Vice President. And he's also the chairman at I Am Pobulayo Fundraising and Resource Mobilization Committee. Mr. Chikwada, welcome.
Good afternoon, Batabile, and thank you very much.
Great. We also have Mrs. Sakile Mwenzi, who is a pharmacist and a volunteer at I Am Pobulayo Fighting COVID-19 Trust as a member of procurement. Good afternoon, Mrs. Mwenzi.
Afternoon, Batabile, and afternoon, everyone.
Great. So this is going to be a conversation, like I rightfully said, and it would be great to approach this discussion at that level. So I Am Pobulayo has so many strides that it has made, and I'll just like to find out from you, Mr. Walter Chikwada, what triggered this multi-stakeholder coalition to come together and mobilize resources to just push the cause and to achieve all the amazing initiatives it has achieved.
Batabile, thank you very much, I think, for giving us this platform to come here and be able to talk about this initiative more on a fundraising perspective. And we've been following through the discussions that we've had in the other webinars in this developing story. Mm-hmm. But like you rightly indicated, we are a trust, a PVO that is registered, which was really started initially when this pandemic broke out into the world. And we were hearing horrendous stories of what was happening in other countries. And it was more in response to a call by government and our local authorities to have a response that for us to be able to look at the health and other related facilities in our city so that we can be able to give a response even as this pandemic was going worldwide. So initially, like you indicated, you know, it's a multi-stakeholder approach. We've got various people from various backgrounds, but when these people got together, there was very, very little time because the organization was not there, it was not registered, there were no legal and governance structures that were there. So within about 30 days, the people had to come together, the Bulawayo community, and put their heads together to say, how do we respond? Mm-hmm. There were some figures that had been put together by a biomedical team, which made up of technical doctors led by Dr. Mark Dixon. And the projections were actually saying we might need anything between 600 to 700 beds by the time this pandemic hit peak in the first wave. And of course, that's how the preparedness came. And the focus then was to say, the more you, if we have to wait for people to get sick, it costs more as you go. You know, there's this COVID funnel where it becomes more expensive from the behavioral change right up to testing, isolation, and treatment. So we wanted to curtail the costs right at the beginning. So the thrust at the beginning was to say, let's look at testing, let's look at isolation, and set up treatment centers and things like that, where we can then manage the process while this initiative was being set up. But I'm happy to say that having done that, we managed to be able to raise some funds right at the beginning, which helped us because one of the things that happened now when it hit us, I think it was in the first wave, we had to close, we had to go on lockdown, but we were not very much prepared for the people who were coming in from the other countries. You know, we are the only city which is bordered by several borders. We've got Vic Falls, we've got Bay Bridge, we've got Botswana. So people were flocking in. So the need for isolation centers and testing and things like that had to be done. We're also very grateful that from some of the donors that came in or the participants that came in, we were able to do testing, like we had the TIBA coming in to assist with the frontline testing for frontline workers. Isolation centers were set up and things like that. So the initiative then took off, where it was prompted basically by this need to say we needed to focus on these activities. So the initial activities were to do with community awareness, social behavior change, resource mobilization, and advocacy. And a number of institutions were obviously focused on. So it was really because of that, Batebile, what I might just say is that with that preparedness, though, the first phase was not as bad as we had thought, because we then had about 1,200 cases, 1,280 cases that were recorded, actual cases, 114 recoveries, 36 fatalities. But where we are coming in now, which is the second phase, we noticed that in January 2021, these numbers had gone fourfold, fivefold up. I think that's the reason why we are here to say, how do we progress forward? But the initial phase was to say, let's capacitate these facilities. And the ones that we had targeted to be able to facilitate were basically about five. I would say there were 5 institutions that were targeted. The number one was the Mpilo National Reference Lab, simply because testing was needed. People needed to know their status. And they were, Mrs. Mwezi is going to take us through exactly what we did in all these institutions. Okay. And the second one, which was very key, was Elangeni Isolation Center. I made mention earlier on that people were coming in, they had to be tested, they had to be isolated. Those who had to be treated had got to go to COVID treatment centers. So all those resources had to be put together initially to look at these initial conversations that were there at the beginning. The third institution that we were looking at was Thorn Grove. Thorn Grove, as you're aware, it's an infectious disease hospital, which had been used in the past for cholera and other things, but it had to be transformed also and equipped to be able to attend to COVID patients. And then I think our key area, which I'll talk about later, was Ekuseni Hospital, which is a hospital that had not been functional for over 17 years, but it had all the basic infrastructure in terms of buildings and brick and mortar, but nothing really inside. And it had to be capacitated again. And it was designated now as a COVID treatment center by the National and Provincial Task Force. So we had to look at ourselves having a response, a robust response in that area. So you'll notice that most of the activities that we did, we were targeting, was to get this hospital operational. But finally, I think the fifth one was the UBH, which we also were looking at making sure that it comes and gives a response in terms of COVID, COVID response, a robust one.
Okay, so your approach in responding to COVID-19 was quite spread out, because you focused on the treatment, you also focused on the isolation, and also you focused on the hospitals, which is quite commendable. So from these targets, I would like to find out then, what then you managed to mobilize since March 2020, which is the time when the trust was established. What were some of the resources that you managed to mobilize, and which institutions benefited from these mobilized resources and fundraising?
Yeah, the trust, thanks, Madebile. Like I said, Mrs. Mwezu just talk about the disbursements that we did.
Okay.
But during that period, we were targeting to raise about $1 million for what we wanted to do. And within the period from March to the 8th of April, we registered the trust, and the trust was launched, and we had to appeal to various stakeholders. The various stakeholders that we appealed to was, number one, we approached the corporates, the mines, the companies, because these were the people who are in the city and they had to give back into the city. The second group that we also looked at was the people who were the health funders. You know, you're talking of your medical aids. There were quite a number of people that we then went in to say we wanted to include and bring in to be able to support us in this initiative. So we brought in quite a number companies, banks, and we managed to raise about $379,000 in the first phase, which we thought was commendable. About 60%, it was a 60-40 split, where about 60% of that came in cash and kind, in kind. The balance, which was about the 40%, came in as cash, and we were able to fund certain things, which we'll talk about. And we are very happy that we had faith-based organizations that came in, that some of them just came and took our quotations, and they went and paid for the things that we're requiring. But one of the biggest measures of responses that we're trying to do, you know, is to have beds in these hospitals. If you are saying you're going to be prepared to offer a response as a hospital, the first port of call is to be having beds. So that was our major thrust, to say we wanted to have beds in these hospitals. So the mobilization was really beds and bed area equipment, ICU equipment, and things like that. So that's the amount of money that we raised. And we believe that we need to move on to the next phase of mobilization to raise more money for this initiative.
All right. So we will discuss at length about the next phase of mobilization. But just about now, I'd like to follow up on the statistics that you've given us, that 60% of the donations were in kind and 40% were in cash. Mrs. Mwenzi, do you mind taking us through the details with regards to who the beneficiaries were for those donations that have been mentioned by Mr. Chkwada?
Certainly. You know, it's the one thing about COVID is that it was a brand new sort of type of pandemic that people were faced with. And as Mr. Chkwada mentioned, the first thing was about testing. And then for a long time in the whole country, we only had Harare as a testing facilities in Harare. And that meant that if somebody was positive here or we were not sure, samples would have to be sent up. So this is where the Mpilo lab comes in.
Okay.
And then everybody thinks, okay, it's about equipment and all that, but there were basic things like water that were not actually available at Mpilo. And that's where I Am for Bulawayo came in. Abantu bako Bulawayo, they mobilized resources, and there was actually like a 10,000 liter water tank that was put up just so that the laboratory could actually function. And then reagents are needed. So the other thing that was lacking, whilst the lab is always there, it didn't actually have a suitable fridge that could store the reagents that we needed to use in the testing. So those were the major things that we did for Mpilo. There's always issues like PPE, even for the laboratory staff, as well as the other staff that are there. And then Mr. Chkwada also mentioned about other areas that we were focusing on. You remember that the borders just suddenly closed and people were like, would need to then come back under strict conditions. So isolation centers also became a highlight. So Elangeni, which is traditionally in Bulawayo, it's like a college or, yeah, I'm not, yeah. So Elangeni was then designated as an isolation center. And so people that were coming through from South Africa, from Botswana, who could not be allowed into the community until we were clear of their status, were actually now isolating at Elangeni. So obviously you can't just put people into an isolation center and not take care of their needs. And that's when, again, the community stepped up and there was food mobilization. So we got a lot of food coming through from certain organizations. And then in the second wave, if you recall that it wasn't so much about people coming through, but it was also about where, if I happen to then get sick, but my living circumstances at home are such that I can't self-isolate, it then became a challenge. So again, Elangeni was an institution that we could actually use for that. And so the donations that were coming through were actually very useful in that regard. Oh, there's so much that has been done, I tell you. Then we have Thorn Groove, which is our traditional infectious diseases hospital, one of our infectious diseases hospital. So at Thorn Groove, again, we had issues with the facility not being up to scratch, and there was a lot of disrepair. Simple things like the nature and the state of the beds, they needed attention. So we actually got a lot of beds that were kindly donated, something like 15 beds to complement what was already there. We also had some waterworks as well that were actually done at Elangeni. At Thorn Groove.
Thorn Groove.
The main center that had actually been designated for COVID-19 to start off with was Egusileni. But as Mr. Chigwada actually pointed out, it's the kind of place that had no, it was not operational. So sometimes you look at a beautiful building and you think, oh, tomorrow we can just get on with it and have people admitted, but it's not quite like that. So we needed beds, we even needed linen, we needed water, there were no fridges. So people stepped up to actually put in a kitchen. So a kitchen was actually installed. We also had laundry equipment that needed to come through. So there's a whole lot of works that actually had to go into Egusileni. So it was basically an empty shell, a beautiful empty shell, but for it to become operational, there's a lot that actually needs to go into that. And then the other beneficiary, as we've mentioned, is United Bulawayo Hospitals through a particular hospital there called BMB. So BMB used to be just like an old a convalescent center. So again, that also needed to be capacitated. So right now it actually has the capacity to admit about 142 patients. And actually in the height of the second wave, this was a saving grace, and we would want to, pay particular, to say thanks to the team that is there at BMB. So a lot was actually then done with respect to giving them PPE, mobilizing beds, etc. So that gives you like a general overview. I don't know, Batabile, if I can also right now probably even go through and just mention some of the goodwill that has actually come through. Should I do that?
Please go ahead, ma'am.
Okay. So our philosophy as I am for Bulawayo is that no donation or no contribution is too big or too small. But obviously, at the end of the day, there's only so much that you can mention in the short time span. So first and foremost, I'd want to say that we really acknowledge and we thank everybody that actually has come on board in whatever way. But I have a list here of about 20 major things that have been done. So these are not the only companies or people that have actually come through, but we have like the laundry equipment that came through from United Refineries. We also have 48 standard beds that were actually donated by the Ecumenical Leaders Forum. So this is like a church-based initiative that also came forward and donated some beds. There's no family in Zimbabwe that doesn't have someone in the diaspora somewhere. And we're happy to say that so many people have actually stepped up. And we actually had an organization that called themselves USA Diaspora Representatives. And we got like 20,000 US dollars for which we used to buy 16 ICU beds. We also had, the oxygen is a critical thing when it comes to managing COVID. So oxygen cylinders that were graciously donated by Nick Graham. We also had Halmine that came in through with boreholes. A lot of these places, when you talk, if you come from Bulawayo, you know that water. Nobody needs to tell you about the water situation. So that came in. Edgar's, they did linen for us. We also had the Hindu Society that came through, beds without mattresses. You can't actually put any patients on there. So in addition to that, we also had mattresses coming through. As I've mentioned, that Ekusileni needed a kitchen. So that came through from Traeger. We also had those groceries, some of them that were coming through for quarantine. Those were coming from Fortwell. We have an organization as well called Bulawayo My Home, that fridge that we mentioned. So that also came through from them. And we had cash donations from a couple of organizations, RNL Biscuits, June Babies. So some babies born in June decided, hang on a minute, let's do something for our community. We also had Alliance Health that came through with ventilators. I remember that right at the beginning, the issue of ventilators. The second wave has been terrible in many ways. There's no family that has not been touched. But one way or another, at least we've managed to have something like, I can see there's 3 ventilators. There's some others that also came through. We mentioned people like Coughlin and Welsh who contributed through legal services. Chigwada mentioned about drawing up the trust and so on. So people think about the disease process only, but there's so much that goes into actually managing a crisis as big as this one. So you have also Highlanders Football Club that also contributed. They donated PPE, gloves, etc. Masca Medical Aid also gave us some bedside area equipment. So there's so many people that have some connection with Bulawayo in their own different way that actually came through and contributed to that amazing figure that Mr. Chigwada mentioned, the 379,000 US dollars. So we could go on until the cows come home, until tomorrow. And if your name was not mentioned, please, it's nothing like I'm saying that every single donation that came through was every bit special. So yeah.
Okay, thank you so much, Mrs. Mwenzi, for that very detailed presentation you just made of the donations that you have received as a trust. So just to follow up on that presentation, I'm curious, and I'm sure the people who are watching right now, they could be curious. And as the moderator, I feel the need and the urge to sort of like ask how this donation, you mentioned a lot of donations that were distributed to specific institutions. You explained very well where what went to Bilo, what went to Elangeni, Thorn Group, UBH. But I would like to focus on Egusileni because people are curious, people want to know, and like you rightfully said, it was an empty shell when you started the project at Egusileni. And some of the leaders at I'm Popular, they mentioned that Egusileni was rather a very ambitious project that the trust ventured on. I would like to find out from both of you what exactly went to Egusileni. If people would have an opportunity to just visit that hospital to see what's there, or if there are images to show the before and after, what is it that they would find at Egusileni Hospital?
Okay. Where it also began was just about clearing the grounds.
Okay.
So we had 60 volunteers that actually took of their time. So many times we monetize everything and we think that contributions is about time, but a lot of people took, about money, but people took their time to actually go through, chop things, there was a lot of overgrowth, etc. And then now when you go into Egusileni, you will be able to find beds.
Yes.
Then it's not only beds, but bedside equipment. So if any of you have ever been in a hospital, you know that when you, right next to you, there's a locker. Next to you, there would also need to be things like the lights and things that make a hospital bed functional. As we said as well, there was, you can't have inpatients without being able to feed them. So the kitchen became very critical. So what we actually got from Traeger was a fully furnished kitchen that came through. Obviously, when we say kitchen, we're not just talking of the fixtures of the cupboards, but we're also talking about 2 stoves, I think, that actually came through. Then when you're going from the kitchen, so you have to feed people, you also need a lot of laundry services. Think about the fact that, particularly with an infectious disease or a pandemic like that, a lot of turnover in terms of clean linen, the clothing that the staff have to wear, etc. So what United Refineries then came through with a washing, industrial washing machines. We also have dryers that are there. You also need to be able to iron that linen.
Okay.
Then one of the attractions about Ebusileni was that it had piped oxygen, but it wasn't also that simple. We also had to do a lot of works around that to make sure that the actual piped oxygen is actually ready for use. In the pharmacy department as well, it hasn't been used for a long time. So, I mean, that one still needs a bit of work, but there's a lot that has actually happened. ICU beds, they're not the same as the beds that you would use in your conventional ward. So you need to be able to deal with a patient that is no longer able to move in any way, etc. So these are pretty fancy beds. So a lot has really actually gone into Ebusileni.
Okay, so is there staff there or leadership at Ebusileni?
Oh my word, how can I forget the people that make things tick? We have a wonderful team there that is actually led by Mrs. Ndubiwa, who is like the chief nursing officer there.
Okay.
And then the acting CEO, who is Dr. Absalom Dube, is the one that's also steering the ship. So we actually have people that, whilst we're talking about these beds being there, somebody has been running around to make sure that things happen on the ground, putting things in place, putting procedures in place, etc. So we actually do have staff that are actually there already functional. And these people, a lot of them came in on a voluntary basis. And then over time, I think Walter will talk a little bit about the operational budget that we're looking towards in the future. But definitely we have staff there. We also have volunteers who have been, people like Pastor Elliot, who runs around and does all the administration whilst everything is being put together. So there's quite an extensive team out there.
Okay, that is really quite interesting and it's exciting, from an empty shell to all those things that you have mentioned. My request really, if I were to be given an opportunity, would to ask that we have a virtual tour of the hospital, because this is a huge milestone from just what you just told me, and it would be great to have that visual appreciation of the transformation that has been made in a space of less than a year. I mean, since the time the trust was launched. Anyway, moving forward, I would like to just find out again from both of you actually. You have mentioned all the amazing work that has been done by I Am for Bulaya Fighting COVID-19 initiative. You have mentioned the funds that you have managed to mobilize and how they have been distributed in from March 2020. Now that we're about to enter March 2021, you are engaging the public, you are engaging us, and you're saying there is need for fundraising. My question then would be, what is the work that lies ahead? What is it that needs to be done to accomplish the work that you set a target to accomplish in response to COVID-19?
If I may come in, Watebile, and just perhaps just to emphasize one of when we were working, especially at Ebusileni, some of the emotional fundraising stories that came through. You had Sakile mentioning that right from the beginning, when the place was opening up, volunteers rocked up from Norway, faith-based from churches. We had traditional leaders rallying around us to come and say we want to do something on Ebusileni. We had football teams like Highlanders coming in to say we want to do something for Ebusileni. We had some of the former football players that were well known in Bulawayo just coming to give solidarity speeches. and do something for Ekuseni. So these are people who came and rallied around a project. And the spirit of that is what we are just trying to call upon now, because as we move on, like I indicated, there are two issues. The first one is that we have an experience, we've just come out of an experience, we're coming out of an experience of a second wave, where we were saying that the numbers were almost like fivefold from the actual numbers that the cases, the recoveries, the fatalities. In the first phase, I understand we had about 36 fatalities. In the second phase, we were on 186. And we just concerned that as we go into winter, are we going to be able to have a robust response with the resources that we have if the peak goes? The second issue really is to do with the fact that COVID came, yes, but it also helped us to identify the gaps and the challenges that our health facilities do have. We don't have the luxury anymore of taking our own across the borders, across the seas to be able to be treated. So it's more imperative and very important that as we move forward, we need to look at how we can capacitate our own health and health facilities and other institutions, particularly these 5 that we've already indicated. I mean, the major 3 ones, UBH, Ekuseni, and Thorngrove. We also have even Matade. Matade, they're also looking for an additional 20 ICU beds. UBH, I think they are looking for an additional 20 ICU beds as well. So all in all, we understand that the actual bed capacity, remember earlier on I was saying, any form of preparedness is going to revolve around how many beds you have as a city, as institutions. The total number of beds that we have are around 404, compared to the 600 to 700 that had been projected earlier on. And of those 404, only 183 will be able to take COVID patients. So there is a big yawning gap that we need to be able to address in order to be able to do that. In the past, what has been very good and reassuring and comforting has been that we have had certain specific donors who would come and say, look, I have a donation, but our donation would want that donation to go to Thorngrove. And we've had donations like that coming through. I think there was Christian Media Alliance that came in through, and their donation went to Thorngrove. There are others who have got a specific leaning towards a particular institution. So we don't want to leave out anyone and focus on Ekuseni. So we want to be open-ended and invite everybody who wants to do something so that we can capacitate the city and be able to give the infrastructure that we require. So in terms of moving forwards, the first issue is that there is a target. Of course, this is a long to medium term. We are looking for about 121 beds to be for the city. These are beds required by hospitals in the city, and they can be manufactured locally. We've got a list that can be provided to the donors. The bishops that were mentioned earlier on by Sakile, we gave them a list, and they went and bought 48 ordinary beds at Daichube, a company in Harare. Just go and pay. So those are some of the initiatives that we are looking at to say, can we get people who can come and assist us to be able to capacitate with the beds? We still have the issue also, I think, to do with the lab. It's an area that is for discussion, whether we can partner with some people who can be able to bring in a lab, or they can help install a lab in that facility. So we've got a list that is there where we can, but short term, in addition to those 221 beds, we are saying Ekuseni needs to open its doors as soon as possible. And for us to be able to target that, a lot of equipment is already on the ground. And the thrust is to say, can we have a 15-bed operational unit where we have 5 ICU beds for COVID and 10 ordinary beds. And the budget for that operational, and the CapEx budget that we have is about 125,000 that we are looking at within the shortest possible time. And our appeal is again to go back. I had said earlier on, there were quite a number of groupings that we had. Number one, we had the corporates. One of the areas, perhaps we didn't underplay them, but the diaspora really came very strong to support us in the first phase. They organized themselves. We were able to set up accounts outside the country, which were managed, like we said, the governance structures had been put in place. The accounting firm, PNAE, are running our accounts. We've got Deloitte and Touche doing our audit. So we had accounts that were set up in America through a company called KPF US, another organization again in South Africa called SAT. They managed to mobilize these funds for us. Some funds came through directly to us. So the diaspora, again, we have this, I would say, a needs basket, as it were, that we've got on the table, where we are offering to say, you can come in and pick what you choose from that budget of 125,000. The other area, again, the other target group that we are appealing to is the faith-based organizations. They came in and did wonders at Epsilon. It's not only the bishops, but there were other faith-based organizations that came in. One of the very, very comforting and emotional times was how we got in together despite the faith. We had the Jewish community, which has already been mentioned. We had the Muslim community that came in and supported us, which has already been mentioned. We also had the Hindu society who donated. So all these faith-based organizations, we are saying there is room for us. This is our city. Let's build it up. Let's capacitate it and be able to see how we can move forward. The next group that we are also appealing to, I know they came in at the early ages. These are multinationals. I remember I was talking about TIBA assisting us with the testing in the early days. But again, we are continuing to work with them to appeal to them to support us. Through the trust as well, we have had some very good working relationships with other fellow trusts. You remember, I Am for Bulawayo was really formed as an appendage, as it were, to business fighting COVID in Harare and Sodzim. And those sister trusts have really come to assist us in terms of mobilization of some of the funds that came through that we were using. So again, that coordination and appeal, we are going to continue to approach them. And then finally, we have a group of individuals that we were approaching individually. You might be aware that Delta Philanthropies are the ones who are funding our admin as I Am for Bulawayo. And we want to thank them for the funding that we assisted, because all the administrative issues were taken care by them. But there's one final group that really also surprised us. It's just ordinary business people in the city of Bulawayo, particularly these who own shops in the western suburbs, those who own shops in the city center. They gathered together and say they wanted to support. So again, this is the other group. So we are going all out to approach all non-state actors to say, let's support this initiative. The information, if anyone needs additional information, I think Batebila will be able to share. We can give detailed information on the budget, the needs basket, as it were, and then we can be able to move forward as we go forward.
Okay, thank you so much, Mr. Chigwada. One thing that I really appreciate from your response is that, COVID identified the gaps, the health institution gaps that we have in the country. And because of that, I'm for Bulawayo came in strong. People in the diaspora, all the supporting members of I'm for Bulawayo fighting COVID-19, just saw it fit and realize that it takes them to cover that gap that was actually exposed by the pandemic. And it is my hope that the efforts continue and we actually meet the target that was set right at the beginning of this initiative. So I also want to just find out. I know you have mentioned that you have reached out to this group, to that group, to the whole public, but I also want to just find out, since this is about fundraising and you're calling out the public to be part of the efforts in mobilizing resources and funds to complete the works, who exactly and how can they be part of this movement?
The initiative is for everybody.
Okay.
This is an initiative which we are saying we want to get assistance from everybody, but we are appealing to all and sundry, like these groups that I've really specifically indicated. We want to be able to say, once we raise, so it's corporates, it's companies, we even still want the traditional leaders that came to support us to come through the mines. We are also looking at, we are working closely, like what we did in the last initiative, fundraising effort, with other BMOs, like the ZNCC, ABAS, Chamber of Mines. So all we are saying is this is our city, these are our facilities, and we need everybody to come on board, irrespective, like Sakile mentioned earlier on, no donation is too small. Okay. We need to have everybody rallying around like what we did, and we can get this to work.
Okay. So I would also like to find out that there are some people who are pro-vaccine, and there are some people who are anti-vaccine. So are there any efforts that the trust is mobilizing or is supporting to try and avail the vaccine for those who would prefer to be vaccinated in an effort to prevent themselves from being infected from COVID-19? Is there anything that you're doing along your efforts of fundraising and resource mobilization?
Yeah, it's really the affiliation to, you know, I'm from CZI. Okay. And we have organizations that are working with I Am for Bulawayo, like the Association of Health Funders. I've spoken about the other BMOs who are already supporting, we've supported us before. But there's a platform that has been set, which is also talking to government to say, how can industry be able to also assist in putting together resources to bring in vaccines, particularly if industry, they've got their own employees. I know that the Association of Health Funders are very warm to the idea of supporting their members. But the good thing along that line, it's that partnership that we have with these BMOs, that they are already talking. I can safely say, I know that there is Bankers Association of Zimbabwe, Chamber of Mines, ZNCC, and the Association of Health Funders. These are people who are already engaged with in discussions with government. So I think it's something that is very positive, which is also happening on the vaccination side, which we have some input into the initiative as well.
Okay, great. So there you have it, Bulawayo, Zimbabwe, and the world at large. I'm for Bulawayo is appealing to you that you support the cause in mobilizing funds so that they complete the works that lie ahead. So, Mr. Chigwada, just to probe you again, do you mind just giving me a brief summary of the things that need to be mobilized and the funds that need to be raised to complete the works? I know you were giving examples here and there. You were expanding your explanation and I mean, yeah, as we were just going through this conversation, for the benefit of someone who's just joining this conversation, and for someone who would just say, you know what, I just want to take a paper and write down the things that I needed. Kindly break that down to me.
Yeah, that list is a bit detailed, but Abila, what we are doing is we've decided to break it down into specific areas that we are going to focus on these target groups that I indicated earlier on. So we can be able to give certain groupings certain target groups. This broken down list, we are going to just break it down. That work is going on. But all I can say is that we've got a budget right now, which are looking at about 125,000, which we should be able to. What we can give you is a summary. Number one, our appeal letter, which details our requirements in summary. Number two, we also give an update of the journey that we've gone from the time that we started. And then we can, upon request on specific things, be able to give this detailed budget. It's a long page, which has got quite a number of things on there. But suffice to say that the summary is about 125,000. This is CAPEX only. Operationally, we will come up with another figure.
All right. Okay. All right, fine. Before I close this amazing discussion that we just had, may you kindly just give me your parting words? What would be your words of encouragement to someone who doesn't understand much about the need and the essence of contributing to such a cause, or for someone who would want to participate and they don't really know much about taking part in an initiative such as the one that we have here at I Am for Bulawayo Fighting COVID-19? What would be your parting words, Mrs. Mwezi?
I would want to take it from two perspectives.
Okay.
First of all, just to share how I actually got involved in I Am for Bulawayo. It wasn't really because I'm somehow involved in health, but it was really about the fact that I live in Bulawayo. And if something had happened to me, my mother, people that I know, there was no solution. There was no plan. And that's how everybody then got involved in this I Am for Bulawayo to say, guys, there's a storm coming, there's a big wave coming, let's do something. So I'm actually here representing your ordinary person, Unavuyo, that's who I am, basically saying, what can I do? And so everyone can actually chip in. You come in, you'd rather call and say, what can I do? And trust me, something can be found that can actually be, it could be, I remember when we were even kids in school, and that's another community that we're also appealing to, that as a generation, you also one day want to be able to say, can you see that hospital there, Egusileni? Guess what? My $10 went into that. And I am also part and parcel of what went into Bulawayo. And then the other bigger picture that already Walter has highlighted, the fact that it's not just about COVID, but it actually made us realize where we stand in terms of health facilities as a community. But the other thing that people would, it will be interesting for you to know is the long-term plan. What happens to Ebusileni post-COVID? Everybody thinks, oh, well, the second wave is over, so they're going to shut down the hospital, blah, blah, blah. That's not, there is a bigger plan out there that is aimed at being the teaching hospital for NAST. Okay. So there is a lot that will actually then benefit the people of Bulawayo. Besides it being a teaching hospital, it will also be an admission facility for general ailments, illnesses, etc. So I would really want to encourage everyone to say, do your bit. You are from Bulawayo. You have some link with Bulawayo. And doesn't it frustrate you, supposing that you're out there not knowing what to do about your family, your friends? So here's an opportunity to actually be able to contribute. You might not be able to be a beneficiary right away, but in the long term, by setting up an institution of this magnitude, it goes a long way. So let's rally together. People of Bulawayo, you've done so well. It's now time to just make sure that the actual institution opens. Like we said, it was a shell. There's still a long way to go, but we're not that far. Let's get it open.
Wow, that is very, very inspiring, Mrs. Mwezi, if you ask me. I mean, you are a pharmacist by profession, and yet you commit so much time to volunteer at I Am for Bulawayo Fighting COVID-19 Trust. I just hope from just what you shared, it encourages someone to realize that there is so much that they can offer besides donating money or any material resources, but just virtue of just donating, you are doing a great deal towards the cause. Thank you so much. And then over to you, Mr. Chigwada. What would be your parting words?
Thank you, Vatebile. I think the Mrs. Mwedze has really summed it up very, very well. And we have come a long way. We are in the final lap. We've told you of success stories that the commitment and the sacrificial even donations that were given. I remember we were talking about Mrs. Ntuviwa. She's now the chief medical officer, but when she came in, she just rocked up and says, "Yeah, I'm a volunteer," and she put up everything together. But all I'm saying is that spirit of saying we are Bulawayo, we can do it. Most of the things are now in place, and we need to be able to just go this final lap. We have an institution that is state of the art once it is completed. And the plans are huge for it to be one of the biggest referral centers, not only for Bulawayo, but for the whole of the southern region. So it can have a huge impact, particularly when it becomes a teaching hospital. So I'm hoping that one of the key things which you mentioned here, Batebile, is to have a walkthrough and for people to be able to see what it was before and be able to see where we are now and what just needs to be done. So let's persevere, but we don't have time. We need to be able to do it within the shortest possible time. We're hoping that this 10 to 15 bed unit should be available even by end of March, if we can be able to open by then. Thank you.
All right, thank you, Mr. Chigwada. So just to follow up on your amazing contribution right there, you're talking of the state of the art reference the center that is still yet to be completed. I just want to find out if I Am for Bulawayo Fighting COVID-19 Trust is the only stakeholder involved in accomplishing that.
No, not at the moment, there are discussions that are going on. You remember I did mention that the National Task Force for COVID and even the provincial, which is ably led by our own resident minister, who's been very supportive of this initiative, okay. Has designated this to be a COVID treatment center. Okay. And government, there are discussions at the moment where there will be some partnership. We are already in a partnership that government is employed all the doctors and the nurses, trained them, they are ready, they are there. We are in engagements at a senior level of the trust on operational costs, how to operate it. Say, once we are done with these CapEx issues that we are talking about, we can easily go to government to say, look, everything is now there. We want to operate this facility. How can you come in? And that discussion is already at an advanced stage. So I think let's not lose hope. Here, we are focusing on non-state actors and say, what can we do? But there's another dimension. We have an agreement with government on the use of that facility. We have an agreement with NASA, who own the institution. We've entered into similar agreements with the local Bulawayo City Council on Thorny Grove. And you see Thorny Grove is already admitting patients. So I think that partnership with government and local authorities will help us to get this thing going very quickly.
Okay. I wish you all the best in completing all the works that lies ahead, and well done and congratulations towards all the amazing works you have managed to achieve in a short space of time. So this marks the end of our conversation with the I Am for Bulawayo Fighting COVID-19 leaders. It's been great. It's been amazing. It's been very insightful. So for those who would like to get a hold of the summary of funds that have been raised and the funds that are outstanding, do reach out to I Am for Bulawayo Fighting COVID-19 Trust by emailing on iamforbulawayo at gmail.com, spelled as I am for the figure BYO.gmail.com, or simply call the office. I'm sure you will actually get the assistance to get a hold of that summary by dialing 0292887521. With that being said, this marks the end of our conversation. It's been great. It's been amazing. You also have been amazing. Until next time, when we engage you on another critical issue at I'm for Bulaya fighting COVID-19, it's been great. It's been amazing. Take care and be blessed.